There are many ways that doctors discover cancerous lesions.
A lot of times it just happens to be an incidental thing when you have a scan for another purpose. People come in for abdominal pain or chest pain.
Often they can determine if something is cancerous or not by looking at a CT, ultrasound, or MRI. But if they're not certain, a biopsy is the next step. It's one of the procedures that independent interventional radiologist Dr. Chris Johnson does frequently.
We are using the image to help guide a needle down to that area that we're concerned about, and we can take a small sample of it to be able to send off to be looked at under a microscope and determine if it is cancer or isn't cancer. And if it is cancer type, we can get profiles on it and help guide treatment.
The procedure itself takes less than 15 minutes.
The benefit of this image-guided biopsy is that it's relatively minimally invasive and the recovery is fast. So we tend to bring patients in and send them home the same day.
Even after the procedure, interventional radiologists like Dr. Johnson will still work with the patient's care team to ensure they get the best possible treatment.
Really, everything in cancer is catching things early. There's always a risk of cancer to spread within the body or to develop in sites that are much more difficult to be able to manage or treat. So if we catch things early and then the biopsy confirms, we are able to treat immediately and treat effectively.
You can learn more by searching for radiology on lehealth.org. For Lee Health, I'm Devin Turk.